At our practice here at Clear Choice, we have a lot of staff that have been with the practice for a long time. And it's sort of different in the sense that, you look at maybe an outpatient surgery center, or you look at an eye clinic, and, there's people who've worked there a long time, but sometimes people come and go. The people we have at Clear Choice are really just passionate about what they do. And we have some really just very unique individuals who are essentially unparalleled in their experience with what they do. So, for example, Jeff Augustine as a refractive OD, I can't think of anyone really like him in the country who's had the experience he's had, from the early days in refractive surgery with your dad all the way through now. He's seen everything predating RK, and now, if you consider Evo ICL or Smile as sort of the forefront of refractive surgery, he's been in that process from the very beginning. So when you talk to someone like him, or when he shares his experiences, he speaks with a lot of sort of knowledge and wisdom. You look at someone like Brian Huda, right, who's our laser boss, our master laser technician. How many people are there in the country who are actively involved at a high volume, cutting edge laser vision correction center, and they also understand how to take apart the lasers and put them back together? You see someone like Jackie, who's sort of our head surgery counselor, and sort of the experience she's had throughout her lifetime in her career, and being able to deliver that sort of high touch experience to patients. These people who come in and they're so passionate about what they do, and they're gravitating towards you and your practice and everything you've built. What is it that draws them there, and how did you sort of meet these individuals or join them sort of in refractive surgery?
Yeah, it's interesting. I think a lot of it is building a culture, around sort of, everybody having the same interest in trying to deliver that best possible outcome. And in a practice like ours, we're sort of trying to push the limits as far as new technology, new techniques, better care, better customer experience. You need a team that all has those same interests. And I think it's sort of self-limiting. The people that enjoy that and want to be part of the team are going to stay in, as long as they can. And the people that maybe aren't quite as interested, will move on and find something else that they're passionate for. But I look at some of the hours we run at Clear Choice, and we're often working evenings, working Saturdays, working Sundays, and more or less, why are we doing that? Well, that's when the patients want to be seen or have the opportunity to be seen. Literally, we did, when flex bending was popular, we did a laser shoot, and a lot of our patients, what we noticed were for flex bending, would put one eye and let's say 1 year and wait for the new year and do the other eye the next year. And they could thus, straddle the year with flex bending and make sure they maximized it. So we started thinking, we're like, well, maybe if we did surgery around midnight on New Year's Eve, we can do some eyes and the 1 year, and then wait till after midnight and do the other eyes after that. And so I was actually out of town, but I said, Shamak, would you be up for that? And Shamak's like, yeah, I'll do surgery. So Shamak did midnight surgery. They did it instead of Valium, I think, passed out champagne. And we had a team of technicians, laser techs, front desk, that were all passionate. They were like, yeah, we're doing New Year's surgery for our flex bending patients. So we had 10 patients that did one eye 1 year and one eye the next year around midnight. And so, not everywhere you're not going to find those type of employees to always be doing that type of service. So, it's sort of self-limiting. I guess, that passion was kind of contagious and attracted the right individuals.